Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 13 new cases of COVID-19 in Windsor and Essex County. 5 are close contacts of confirmed cases, 2 are community-acquired, and 7 are still being investigated. We have had 16,688 cases since the beginning of the pandemic. 147 people are active at this time, and 60 of our active cases have a variant of concern. To date, 1,875 preliminary or confirmed variants have been identified in Windsor-Essex County. Currently, 16 people are in the hospital and 3 people are in ICU. I'm sorry to be reporting an additional death today due to COVID. A man in his 60s from the community has passed away. Our community has now lost 432 people to COVID. There are currently 7 active outbreaks in Windsor and Essex County, 6 workplaces, and 1 community outbreak. Regarding the vaccination progress for our community, 316,337 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 262,408 people have received at least 1 dose. Overall, 71.9% of adults 18 years of age and older in Windsor-Essex have received at least 1 dose of a COVID vaccine. This number has changed due to some data cleanup and the removal of duplicates. 15.5% of our adults 18 years of age and older are fully vaccinated with 2 doses. Residents of Windsor-Essex County 12 years of age and older are able to book their vaccine appointment for a first dose at one of our mass vaccination sites. So please note that also select pharmacies and primary care providers are providing vaccine. Seniors 70 years of age and older are able to book their second dose appointment as well. In addition, we have extended the date and those who received their first dose of vaccine up to and including April 18th are now able to book their second dose at one of our mass vaccination clinics. This would have been opened up as of 9:30 this morning. Those who received AstraZeneca 12 weeks ago are also able to book their second appointment. For those who would like to receive a second dose of AstraZeneca, please contact your pharmacy or healthcare provider where you received your first dose. If you would like an mRNA vaccine as your second dose, please visit wevax.ca to book at one of our clinics. Again, please book your appointment at wevax.ca or by calling our call center at 226-773-2200. If you are eligible to book your first or second vaccine and have booked your vaccine at another clinic or received your vaccine elsewhere, please take a minute to either go online at wevax.ca or call the call center to cancel your appointment. We have a button on our booking site that allows you to view and or cancel your a reservation. This will allow others to use this appointment time. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us again. We continue to make progress in our fight against COVID. We came a long way since we had our first COVID case in March of 2020. Our community faced many challenges throughout the course of the pandemic, and we witnessed some of the highest rates of COVID in our community. We are vaccinating our community at a rapid rate. We probably broke our record yesterday by vaccinating more than 6,675 people just yesterday. We are giving out more than 80% of our vaccine as second dose, at least in the last 2 days. How did we accomplish all of this? And if I have to go back and pick just one thing that helped us to fight this pandemic, was the true spirit of community and how the community came together to fight this pandemic. We live in a community that truly support each other and have always worked together to do the right thing. In the last 2 weeks, we heard the most disturbing news in Canada that was not linked with COVID. First was the discovery of the mass graves at the residential schools in Canada. Probably the saddest moment for every parent to learn the existence of the mass grave of 215 children in Kamloops. Those children were truly innocent and didn't get the opportunity to live in this world. Such a tragic event. I don't even have words to describe how devastating it must have been for their parents. Truly heartbreaking. Second, an act of terrorism as described by our Prime Minister. The killing of an entire family by someone for the reason of them belonging to a specific faith, specific race, or ethnicity. How did that happen? I am a proud Canadian. I chose to make Canada my home because I truly love the Canadian values, and I'm always proud to say that how Canada is one of the best places to live in this world. How we truly value life and appreciate the diversity. How we treat everyone with the same respect, and how no one is considered superior just based on certain features or characteristic or race or ethnicity. But today I feel sad because of these events, and I know that these are not the Canadian values. The true Canadian value talks about tolerance and use our diversity to do good things for Canada. Our community really worked hard during this pandemic together, supporting each other in everything. Each one of us has given many sacrifices to ensure that we move forward as a community and not leaving anyone behind. The true spirit of community, the willingness to support each other in these difficult times, the need to look after our loved ones, the willingness to support our vulnerable population in so many ways, either by bringing even just groceries for them, or taking people to important appointments when public transit was not available, or to support our local businesses by buying local. Every act of kindness and generosity was critical in this fight against COVID. Let us focus on kindness, tolerance, and gratitude for each and every member of our community. Each one of us have suffered in so many ways, mentally, physically, economically, socially, that we can't even measure. We must not forget that we have to be kind to each other, and we don't know what the other person is experiencing or going through. We can only see what is in front of us and can never understand what is going behind the scene. The only way to show our respect is by being kind to each other and support our community. I'm truly honored and blessed to live in a community to see the kindness of many, and I hope that we spread kindness everywhere in our community, in our province, and in our country, and rise above all challenges. Let us not fall into hatred towards anyone. Let us pause for a second and give respect and honor to those who lost their lives, and please be kind to each other and rise above all the challenges. Thank you.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Yeah, so Dr. Ahmed, this Friday will be the first time that outdoor dining will be permitted in months. Any words of advice as the restaurants and food service industry move towards reopening?
Well, I think it is important that when all these businesses are preparing to reopen, they need to look at their COVID response plan as they are required under the regulation to make sure that their plan takes into consideration of all the COVID related measures and following the protocols identified in those regulations, ensuring that the employees are screened, and using all the personal protective equipment as they are supposed to, and ensuring that they're keeping everyone safe. People who work in those industry, if they haven't been vaccinated yet, they should get the vaccine as soon as possible to keep themselves safe and everyone around them safe. And most importantly, if you are sick, please stay home and do not go out in the public. And if you are booking any of these tables and making reservation, please make sure that who you are connecting with, and try to stay with your own family as much as you can.
Will public health officers be doing any enforcement over the weekend?
Well, we always do the enforcement and compliance check, and we'll continue to do that, recognizing that this would be a change from what we were seeing before. So I'm sure that they will be out and ensuring that public health measures are being followed.
Thank you.
Any questions from AIM 800?
Doctor, just in regards to the single day doses of vaccine, I believe you mentioned over 6,700. What do we usually see in Windsor-Essex on a daily basis?
Well, it fluctuates from day to day, right? So on an average, I think last Friday we reported that we were vaccinating more than 4,000 doses a day, and in some days we were touching close to 6,000 doses. And I was looking for some of these numbers for other reason, and I noticed that we actually vaccinated 6,675 people yesterday, which is a pretty significant number in my opinion. And when even I was looking at the breakdown, we vaccinated 84% of the vaccines that were given out yesterday was given out as a second dose. So we are making good progress in even giving out second doses to our community, and that's why I wanted to acknowledge the good work that has been happening everywhere, and how important it is for us as a community to work together to do the right thing for our community. And so we're looking forward that, you know, as more and more vaccines are coming into our region, how quickly we can continue to vaccinate our people.
Any reason why there was that slight jump yesterday? Are more people booking appointments? Are more appointments available for individuals to book? Is there any reason why?
Well, we always look at our capacity, and again, just thinking about, you know, going back in the initial phases of the pandemic and how these booking appointments and all the infrastructures are set up. First dose, it takes time for people to go through the consent. They don't know what's happening. Sometimes they don't know what vaccines are they given. They may have some questions. With the second doses, that is increasing now. You can anticipate that that will be a quicker process. So there will be more capacity in the system. There will be more opportunity for people to vaccinate. And also, you know, looking at our vaccine inventory, and if we have a vaccine that are here that we can use, we do that. So it's a combination of multiple factors, but as I said, it fluctuates. There have been previously days that we touched the 6,000 marks. I don't know if we have done more than 6,675 doses before. So that's why I think that it would be a record for our community, and but we are hoping that that's not the only record. We should be able to vaccinate more people when more vaccine come into our region.
Thank you.
Any questions from CTV?
Yes, good morning. At the current vaccination rate, are we on pace, locally at least, to reach the 20% second dose requirement to move into step 2 on July 2nd?
I think so. So just for our adults, we have already crossed 15% of our second doses in the community. And if that's the number that we continue to follow, I'm quite confident that we will be more than 20% even before July. But I'll just hope that things progress the same way as it's been progressing, and we'll be way before we hit July that we complete our 20% mark.
Okay. And as a border town, are you comfortable with the easing of border restrictions for people who are fully vaccinated?
Well, I think that's the eventuality that we have to look at. There is data coming out for people who are fully vaccinated, and the risk to the community decreasing with the COVID cases going down. So I think we truly want to see that enforced appropriately, and ensuring that anyone who is visiting or traveling are fully vaccinated, but still, you know, taking all these precautions. And I think I don't want to sound like a broken record, but all these restrictions, it will eventually ease off. So rather than rushing it in, we want to make sure that we take it slowly still, because we have active cases. Our active cases has gone down less than 150 in our community, which is great. But that means it's still there are 150 people that we are aware of that are currently infectious. And if we use the same numbers, and if we look at the vaccination rate across the border or in other countries, other jurisdiction, other regions, it varies. So it truly is a reflection of what we can anticipate as the world continues to see cases of COVID. We are in a much better spot, but travel, it does comes with its own risks and challenges. And I think we just need to be careful in who we are allowing and what criteria we're using to allow these people to travel.
Thank you. Manitoba has unveiled immunization cards for fully vaccinated people. Would you support something like this?
So can you repeat your question again?
Sure. Manitoba has unveiled immunization cards for fully vaccinated people. Would you support something like this?
Well, I think that's the eventual reality, and as I said earlier, that we will have to open up travel, and everyone wants to travel, including myself. So how do we do it safely? So I think it's just a matter of ensuring that all those steps are in place. Being a border town, just like you identified, there are people who have received the vaccine, but currently may not even be registered into our system. How do we even know about those people? What is happening to the people who are crossing the border every day? Like, we don't have some of those systems in place. So we want to make sure that those systems are in place to ensure that only the right people are allowed to travel and protect our community in a safe way, in a better way, by ensuring that they're all vaccinated.
Great, thank you.
Any questions from CBC?
Yes, good morning. As of yesterday's numbers, there were only about a dozen of our active cases that were unknown or under investigation. I take this as a sign that the numbers now allow for, case and contact management to go much more smoothly than in the second wave where we had this avalanche of cases. So my question is, how much of a difference does it make knowing that you're able to track such a high percentage of the cases that are out there now?
No, that's a key public health function. We definitely want to track, trace, and isolate people with any kind of potentially infectious diseases risk. So COVID is something that I think everyone is aware of, that how we are tracing, tracking, and isolating these individuals. But there are other infectious diseases that our team has always worked to trace, track, and isolate those people to protect the entire community. So all of those efforts and all of those work has already been there. With the high number of cases resulting from COVID, with basically no immunity in the general population, has led to this risk, and letting it become a global pandemic is just the lack of ability to trace, track, and isolate these people very quickly. So we definitely feel much better now that we have the capacity, now that we are talking about the real public health interventions. And I want to just take that opportunity to say that, when people think about the public health interventions, they see that it's generally like restrictive, that we shut down things, we say don't do this, don't do that. But the true public health intervention that we are talking about right now, the true long-lasting intervention, is the vaccination. And we know that we are doing good progress in vaccination. So that's the true public health interventions. All of the others want temporary interventions to get to us to the point where we can implement the long-term sustainable public health interventions. So we are getting there, and the ability to trace, track, and isolate these people after having a high vaccination rate is something that we need as a community to keep everyone safe. So we're really happy. And we hope that the cases continue to decline, and then we don't have to worry about even delaying any of these tracking these cases down.
On the topic of vaccination, I believe that the number of temporary farm workers that have gotten their first dose is around 5,000 right now. What's your estimate for how many workers in our community that are currently unvaccinated?
So we've always seen some fluctuations in terms of the number of temporary foreign workers. So according to our estimate, it ranges anywhere between 8,000 to 10,000 in our community in the peak season. And again, the season is the peak season is starting now. Our temporary foreign workers, our farming operation is year-round operation because of our greenhouses. But we do see the number of people coming and leaving changes accordingly. So right now, if we go with that, I would say I think my numbers combined with the numbers of temporary foreign workers that are landing in Canada and offered the vaccine, a combination of those is somewhere close to 6,000 or a little more, over 6,000 people that are currently vaccinated. And so if we use the number of 10,000 as the overall number, as the maximum, then that means basically we have vaccinated more than 60% of our temporary foreign workers with at least one dose of vaccine, which is really great compared to what we would have seen because of the vaccine hesitancy and everything else. So I think the temporary foreign workers, they did the right thing. The owner operator, the industry really worked to get their workers vaccinated to protect their operation and also to keep them safe. So I think a combination of all these efforts really was helpful in keeping them safe. And we will be looking forward to give them their second dose of vaccine to complete their series and ensure that there is no further outbreak in that population.
So you're happy with the current rate, but are you seeing some of that hesitancy? Do you think that is reflected in the coverage rate that we have?
Well, I think overall, if I see, it's not different than what we are seeing in our general community. There's always some questions, and I think our team and the partners did an excellent job in even answering some of those questions. We were able to provide information, educational material in their own language, and that really helped to remove any of these barriers and misinformation that they may have. So overall, I'm really happy to see that rate, and I truly hope that we are able to give them the second dose and to get them the protection that they need because of their high risk of living in a congregate setting and due to their travel-related risk.
Thanks very much.
Any questions from CFTV?
Yes, good morning, Dr. Ahmed. I was wondering, do you have any information on the development of a vaccine for kids 11 and under? Parents are kind of wondering if there's going to be a vaccine.
Well, I hope so, that there will be a vaccine for kids 11 and under. And as you know, that this virus is still new, and obviously because of the regulatory requirement, because of the clinical trial that they have to go through before any vaccine is approved for use in any specific age group, it takes a little bit of time. So it took us time from approving the vaccine for 12 to 17 years of age after looking at the clinical data. I'm sure that there must be other clinical trials, other research that's been going on to test the vaccine in children 11 years and under. And we know that the vaccine, like the majority of the vaccine that we give out in this time is given to children and to ensure that they build the immunity against some of the deadly infectious diseases that the world has seen, and to give them the protection and give them the health and protection that they need throughout their life. So I am confident. I don't have a timeline that when we will see the approval of the vaccine in children 11 years and under. And trust me, I get asked this question even in my own home from my child that, when am I getting the vaccine? So just like everyone else, I'm also waiting to see some clinical trial data and then the approval of the vaccine in the younger age group.
Okay, thank you very much.
Any questions from Blackburn?
Yes, good morning. The Southwestern Public Health just announced that they will only be giving out Pfizer due to supply issues of Moderna. Have we had any similar issues down here? Are you strictly giving out Pfizer now, or Moderna still available for us?
So I'll answer that. So we, at all of our mass vaccination clinics, we typically give out Pfizer. We are one of the health units that have received Moderna as well. So we do have a stock of Moderna, and we are anticipating that the Moderna that we have will be used for second doses of Moderna. So just like relating that to the question about the temporary foreign workers and the vaccination efforts with the farms, they all had Moderna. So we anticipate that we'll use our small supply of Moderna for the second doses for the farm workers, for our mobile clinics, and some of the primary care providers. So we are using what we have, but primarily in our mass vaccination sites, we have Pfizer because we know that that's our most vaccine. We get 21,000 doses of Pfizer every week, and that's the consistent amount.
So for people who got Moderna for their first dose at a mass vaccination clinic, will they have the opportunity to get that again, or will they have to go to a primary healthcare provider to get that second dose?
So in our booking system right now, it asks you which vaccine you received as your first dose. And so if you have indicated you received Moderna, what we're doing is we're tracking all of that and making sure each of the clinics have enough Moderna to provide second doses for those that received their first dose at a mass site. So it is still available. At some point, if we run into an issue with Moderna, then we will look to Dr. Ahmed about the ability to give Pfizer as the second dose. But right now, we are giving all second doses to whatever you got for your first dose, with the exception of AstraZeneca. So if you received a Pfizer, you're getting a Pfizer as your second dose. If you received Moderna, right now you're getting Moderna as your second dose.
Thank you.
Any additional questions from the Windsor Star?
Nothing further, thank you.
Any additional questions from AMA 100?
No, thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from CFTV?
No, thank you.
Any additional questions from Blackburn?
No, thank you. Have a good day.
Thank you, everyone. See you on Friday.